Hope College students are back on campus, and the school has now come up with a unique system to track potential COVID-19 infections.
It was created by several Hope professors and could be used on an even bigger scale in the future. Our Michael Martin spoke to one of those professors involved to hear exactly how it works. Michael?
Yeah, Annie, Doug, good afternoon. What they're doing to get a better grasp on how the virus spreads is pretty fascinating. They're testing the wastewater that comes out of residence halls or apartments to find presence of COVID-19. And once they find the virus somewhere on campus, they can then test all of the students living in that area.
If you think about Hope College or any college, it's basically a small city. And you need to be able to monitor as many of those people as possible.
Students are back on campus at Hope College, although this year, those walking the grounds are taking a long list of safety precautions against COVID-19. And all of them were required to be tested before returning.
Anybody coming back to campus had to test negative in a test prior to arriving to campus.
If a student is showing symptoms of the virus once they're here, they are required to be tested again.
One of the interesting things about this virus is that it appears that a fair amount of the people that are infected may not actually show any symptoms, so they're asymptomatic. But they still shed the virus and they can still infect other people.
And because of this, several Hope faculty members, including Dr. Aaron Best, started working on a way to monitor the wastewater coming out of student living facilities for the presence of COVID.
So we've broken the campus down into 10 zones, and each of those zones represents about 200 to 250 students wherever they're living. And so that might be 2 or 3 dorms put together, or dorms and cottages and apartments that the college owns.
Monitoring a huge population of students all at once, testing people who are less likely to outwardly show symptoms and therefore less likely to go get tested on their own.
Say it starts to increase 3 weeks from now or something like that. And it increases in zone 1, but it doesn't increase in zone 2. That allows for the other parts of the testing strategy on campus to focus in on that zone. So individual testing, for instance.
It's a strategy that has taken a lot of effort to be developed and implemented, but Dr. Best says it provides a valuable vantage point for dealing with the virus.
It's very possible that the wastewater signal that you have is ahead of a hospital seeing cases. And so there might be a lead time. So it could in fact not just be a surveillance of the current burden, but also a predictor of when you might see burdens at hospitals in a clinical setting.
So while this team is focusing on the population here at Hope, it is possible that this approach could be used in a more large-scale setting to monitor an entire city's wastewater.
There are logistical issues with scaling, of course, but there are many groups around the nation and really around the world right now that are trying to ramp up this kind of testing to do exactly that.
Yeah, and so there are other areas around the country that are taking a similar approach to testing wastewater. In fact, the CDC announced just this week that they would be launching an effort to gather some of that wastewater data from around the country just to give them a better understanding on how and where the virus is spreading. For now, live in Holland, Michael Martin, Fox 17 News.
Certainly innovative, Michael. Thank you.